Hey. So I am Susie Schwartz, otherwise known as the medical mistress, as in, let's miss the stress, ditch it, get rid of it. I've had chronic illness all my life, almost since 9. And I'm about all those things, all the chronic illness things. And we have a special person today to converse with. But before I get there, I'm just going to say two things. First of all, I had an eye appointment today and my eyes are dilated, which means I look stoned, but I promise you I'm not. And also, none of my glasses are the right distance for this situation. So I can kind of see you, but it's not perfect. Second, my dog, Carlos, my little white, mostly white chihuahua, just jumped on me before this, and I'm wearing a black top. So if you see any hair everywhere, it's my dog. Anyways, now to speak about this woman sitting beside me here. This is Barb. She also is a dog mom, but maybe more importantly, a person mom. Person mom? Person mom. Yeah. She has a child and is a wife. And for our conversation today, what's most important is that she is my friend and my cousin, actually. But actually, okay. So maybe most important for this conversation is that she is a nurse. She has her BN and is her current position is a clinical resource nurse in a trauma center in Winnipeg, Canada. It's busy there. Let me tell you, folks, I've had to go there multiple times back in the day, and it's hopping. So, welcome, Barb.
Thanks for having me.
You bet. All right. So why don't we start with what a day looks like in the ER from a nurse's perspective? What can you tell us about that?
A little crazy. There's lots of different in the ER. So from the bedside nurse to the triage nurse, we've run a little clinic where there's lots of different areas. But I think for triage, they're coming in looking at, depending on the day, but you can walk into 30 to 50 patients sitting there already when you and you're expected to get report on all of those patients and be able to keep track of them all, be reassessing them um, theoretically on an hour to every 2 hour basis, as well as triaging all the new patients that are coming in. And when a bed comes available, they're the ones who have to say, this is the sickest person here that needs this bed.
I can't
Um,
imagine that's easy. Ugh.
yeah,
How do you
pretty stressful.
rate? How do you rate who's the sickest? Yikes. I mean, I'm sure you have a system, but I can't imagine it's easy decisions to make.
No, highly stressful. I mean, ideally, you have a bed available for that sick person that comes in and they go there, but that doesn't seem to be the way that they're living in it these days.
Mm.
So stress. It used to be you could start a morning shift and not have an entirely full waiting room, whereas now that's kind of more the norm. So you're trying to play catch up on the last shift's patients as well as keeping track of the ones that are coming in.
Oh, right.
Um, and on top of that, you also have patients that just because there isn't enough space that they're putting have been seen and treated and have been put back to the waiting room to wait for social work or other services, which you're also
Mm.
track of and are they still there? Are they okay? Have they been discharged to the people that have seen them needed to be seen? So they always tell you the most important patient walking in is the one that hasn't been triaged yet because you don't know what they're there for.
Right.
So that's kind of the priority. So if you have a stream of people coming in that are getting triaged constantly, then the people that are already triaged and sitting there may not be getting reassessed as often as they would like them to be, which conditions can change, especially with long wait times. So it's definitely a balancing act. You also have all of the EMS that comes in down a hall that the waiting room doesn't necessarily see, that you're trying to sort that and triage those and keep everything going and everybody alive.
Yeah, and quick question on that. Are the paramedics sitting with those patients?
The paramedics at our department, we have 45 minutes to offload them. So depending on how busy any particular moment is, sometimes it takes the triage nurse 30 minutes just to get to them to get the triage done. So quite often the medics are walking away at 45 minutes, and now you have a hallway of patients as well. That if they are left in the hallway, it's because they can't safely get to the waiting room. So they can't sit in a chair.
Oh, I see. Got it. Okay. Right. Right. Okay.
Reasons. Sometimes it's an elderly person with a hip fracture, or sometimes it's somebody that's just so sick that they can't physically sit up in the waiting room.
Right. Okay.
And so that's a balancing act. You also have consult services that are coming in looking for places to see patients that they've asked to see through the emergency department. And they'll oftentimes approach the triage nurses and being like, oh, I just need this done. And it's not realistic for the triage nurse.
Right. So those people would be the ones, like, I've had the doctor say, I'll call ahead, like, go
Yeah.
there, I'm going to call ahead. That's what you're talking about.
Yeah.
Okay.
And it's difficult. This may be a little bit off the question, but difficult in those situations because the impression that the patient has is that we're all going to be waiting for you when you get there.
Right. Of
Right.
course. That's how I used to think that. I don't anymore, but it sounds
Yeah.
like it's a direct line. That it sounds like, oh, I've got the in, I get to bypass everyone already sitting there, but not
Yeah.
the case.
That they've given us a call to say this person's coming in, but then the consult doctors themselves have to be available, and we have to have a space for that consult to see that person.
Right. Okay. So then take us to they've been through triage. Now they're ranked, for lack of a better word, and as far as like how soon they need to get seen. They go back there and they are now assessed by a nurse. What, how did you term that?
Bedside. So depending on when you come in, if you are, considered critical, you're going to be going to the resuscitation room, which we all hope that's not your case coming in.
Right.
But they're typically the only ones that are rushed right in.
Right.
So then it's depending on where you go. We have, the beds. We also see patients in chairs. So it depends what you're there for as to where you go. But essentially, it's the same thing as far as on the nurse's side. So you're going to meet the patient. You've already kind of have the triage note, but you go through your assessment. So it's initially asking why the person's there, kind of doing your head to toe assessment, and then you wait for the doctors to come in. You're balancing that with the patients that are already in the beds. Lots of times at this point in our lives, we have multiple admitted patients. So you're balancing trying to maintain all of the admitted patients' orders. So that's the medications and everything that they require, as well as the patients that are kind of unknown coming in and getting IVs and blood work and all the things. If you happen to have a nurse that's also on our resuscitation team and trauma or someone critical comes in, then that nurse has to stop what they're doing and run into the room to stabilize. So we try and do team nursing. So you have buddies. So it's 2 to 3 in your area. So we try to leave 2 nurses on the floor in an assignment because they'll have potentially around 7 patients at a time, to allow theoretically breaks to happen, as to allow flexibility depending on what's coming through the door to be able to go to those critical patients. As far as my role, I'm the resource nurse, or the also frequently called the charge nurse. So my job is to get report on everybody in the department. So that can be, 100 plus patients at any given time. We focus on kind of the most acute sick patients, and then kind of highlight the patients that are in the waiting room waiting for certain things, any discharge issues. We have to go into rounds at around 9 o'clock in the morning, which is the team. So it's occupational therapy, physiotherapy, home care, Aboriginal services, spiritual care, the bed coordinators and utilization. So we try and make sure everybody's on the same page as far as what needs to be done to get patients discharged, as well as patients upstairs to the beds where they should be. I do a lot of balancing between discharge issues. We have a lot of difficult discharges for we have a high homeless population. So making sure that people have the resources in place that they need.
Right.
As well as, there's times in report where I have my list of patients and I kind of, oh, something's coming into recess. I don't have enough staff on. I've got to run into the room, toss the paper at them and run out.
That was my next question. How often do you actually have to then become a bedside nurse as well as everything else you're doing?
Lately, fairly frequently.
Mm.
Staffing has gotten a little bit better for us in the last while. That said, it's a lot of new nurses, which means that I'm not specifically taking on the assignment. However, you're trying to provide a lot of additional support, where you used to be able to buddy up kind of a junior nurse and a senior nurse for learning purposes. That's not always feasible. You don't have that ability because you have a lot of nurses who have only been nursing for a year or two. And it used to be that you had to have 2 years experience somewhere else before even working in our department. And that's gradually kind of gone away just because we just need the nurses. So
well, I suppose between a nursing shortage in general, a pandemic, and a broken system, that all contributes to needing to put those newer nurses in there because you don't have the lifers anymore like you did before, I suppose.
Barely people with experience even applying for the positions.
Right.
We have I think the workforce in general, that's the case, is that it's a fairly young population. You have kind of the more experienced senior staff everywhere kind of reaching the point of those numbers are much less. That's just how society goes, and birth rates and everything else. And this seems to be the situation that we're in. And certainly the pandemic, a lot of people left, a lot of people burnt out and said enough. Anybody that could retire did. It's kind of a perfect storm at this point as far as how the staffing numbers just plunged.
Right.
For a while there, it was nothing for me to be coming into a weekend night shift and having half my staff and going, okay.
That's terrifying. It's terrifying. As someone who's needed the ER, come on, government, we got to do something about this, because that is it's more than a pickle. Let's just say these are people's lives that we're talking about, including the lives of you as nurses and doctors, because I think that burnout, I'm sure, is feeding into your own, not you specifically, perhaps, but your own quality of life. And the body knows when we're under stress, and perfect storm is the best way to say that, for sure. So are some patients easier to deal with than others? In of course, I'm not talking about heart attack versus amputated toe, which I've been talking a lot about toes lately because I just had my big toenails removed. But anyways, let's not, that's not what I'm getting at here. I'm wondering, in attitude, I'm sure you're dealing with people, so there's got to be people that come in that are more difficult than others. Yeah,
definitely. It works anywhere in the department. Certainly at triage, a lot of tempers flare because of very long wait times.
With the patients, you mean?
Yeah, patients, visitors, family. Right. Multiple things. It certainly plays into it. If you have two people that are equally sick and you have, one person who's yelling at you, your human nature tells you, who do that bed, right?
I think that's it's an important point, because I don't know why we as humans think that making demands in a disrespectful or aggressive way is going to get us to our goals faster, because I would say in general that's just not the case. Like, yeah, if you're having a stressful day as a nurse and you have like you said, equal problems, difficult, angry, aggressive versus like kind patient and like, will you please help me?
Yeah. And certainly you have somebody who, has been waiting forever, and you're reassessing them, and they're not complaining, and they're just being kind of like, oh, you guys are, you here, oh, you guys are working so hard. I know you're busy. You know, that, they're the triage nurses, the staff in the back, their hearts are breaking. They want to help this person. Right.
Yes.
Um, it certainly makes you want to go where, I mean, everybody's going to get the basic care that you're able to give in that time. The difference I see is I might go on my break to do something for that patient that was super sweet and nice and helpful. Like I might take that extra, where it's somebody who's been awful. You're probably not going to go that extra mile, and that's human nature, right? And it's not saying that they're not getting the treatment that they need. You're regardless. And we certainly see, we have a population that's difficult to deal with. Just there's a lot of substance abuse and everything else, and I think the staff that I work with have kind of a bit of a heart for that population, anyhow, or we wouldn't all stay here. But it's very much if you are it's in the moment, right? We all know that people are in their worst place coming in the department. So it's not a matter of somebody that's visibly upset and just in the moment, this is their emergency, right? This is their crisis. And people can recognize that. And it's not that I'm talking about. It's the ones that no matter what is happening they don't see outside of themselves. They're constantly like, it's all about them. And you could have just, they could have seen you doing chest compressions on somebody, but the fact that you didn't get them that glass of water.
Yes.
Right? When you said you were going.
Well, and I'm just going to jump in here and give a little pet peeve that I have on behalf of you as nurses, because I've been to the ER, enough times for my own sake, as well as I used to, unofficially volunteer getting those glasses of water and running errands for people while they're waiting, because I know it's a stressful time. And I thought, well, I know what that feels like. And sometimes you just need someone to be a placeholder so that if they call your name while you're using the loo, then I live in England now, by the way. Yeah. Anyways, that's not my point. Point is, on multiple occasions, I've had people walk into the ER, sit for a bit, talk amongst themselves about how ridiculous it is how many people are there, huff and puff, go to the front, like nag a little bit, sit down, get told the wait's going to be a while for them, and then they go home. Now, I don't know. Like, if I'm frustrated by this, as I suppose I'm frustrated because on your behalf and as a patient, if you can just walk up and go home, go see your GP or go to an urgent care. Why are you in the ER if you have the option to leave? Anyway, let's not get on that tangent. I did it for you. You probably feel the same way. Not if you agree. It's frustrating. But hey, at least if they leave, it opens up a spot for someone else. But let's not get, yeah. Oh, sorry, go ahead.
No, there are people that do leave when they shouldn't. So that's a bit of, right? Certainly I know exactly what you're talking about, and we won't go down that rabbit hole, but I do say that there are some times when it's the people that should wait that are the ones that,
and I suppose I'm not necessarily seeing the ones that, maybe that's the case for some of the ones I witnessed. It seemed like they came in with a entitled attitude and don't have the patience to wait the 2 or 3 hours that it used to take when you went to the ER, and then just was like, well, no, I'm going home to watch the football then. I have a feeling the ones that leave that shouldn't are probably, well, maybe not leaving more quietly, but good point to make. Good point to make, because I'm talking about the complainers, but I suppose there is legit. Yeah, people shouldn't leave necessarily when they do. So good point. So what is the most rewarding thing for you as an ER nurse?
I guess that's a little bit of a two-sided answer. I've certainly, part of the reason why I love emergency medicine is because people come into you as a big question mark. And I love, it's kind of like solving a puzzle. What's going on? What is wrong with this person? And then figuring out how to fix it. Um, so that's very rewarding when it happens. I actually like the difficult cases where everybody's kind of a little bit like, what is happening? This is like not the typical where somebody walks in and you're like, okay, it's probably this. We know the answer. We know what to do. And it's
Right.
more of the one, it's stumping everybody. And you're like, and when you actually figure it out and get the patient the treatment that they need to get them better, that's very rewarding. And then on the flip side of that, it's the small moments. Having a moment with where you can connect with somebody and actually feel like you've made a difference in their life. And it can be something small, like just taking a moment when they need to be repositioned in the bed and taking the time to do it and have a conversation while you're doing it. Sometimes those little jokes at the bedside with the patient make a big difference. I think that that's probably for me anyhow, probably the most rewarding. I don't necessarily in a lot of my role now get those moments very often. So, because I'm either dealing with patients who are so sick that you're not really having the conversations with them because they often can't talk, or I'm doing more putting out fires. And if there's complaints, I'm often the one to go up and deal with that person that's complaining and angry. Um, and then just balancing staffing and trying to provide support and make sure that patient flow is priority of my job, is making sure that we're able to move patients through, and it's a little bit of a clam game these days, but to make room for the acutely ill patients that come in. So it's in those small moments that when I do get that opportunity that it makes
Okay.
a difference.
So you were a bedside nurse for quite some time before you took this current role. And I know you mentioned to me once that sometimes you sing to your patients. Tell me more about that.
Well, I do a lot of singing. Songs pop into my head a lot in scenarios, but um, we see a lot of mental health, a lot of patients that are on in psychosis related to methamphetamine and all kinds of things, and we often have to give them sedating drugs. And not that it works a lot with that particular clientele, but I often will start singing lullabies as a soothing,
Mm.
let the tone down. It can be very chaotic, you know. Um, I think sometimes it's a bit of a for my benefit more than theirs in those moments. But I can also say that, especially during the pandemic, I can recall instance when family wasn't there because there wasn't visitors allowed, and patient took a turn for the worse very quickly. Um, and we called the family to try and get them in, but I could see that she was dying potentially before they could get there. And I thought, I can't let this woman just sit here.
Mm.
I just sat there and I held her hand, and she didn't speak the same language. So I just sang, just quietly with her while I held her hand. And I don't know whether she even could hear at that point, but again, I don't know whether it made a difference, but I figure music is often a communication that's doesn't require the language.
I can say this definitively that it made a difference. And I just want to thank you for that, because I can imagine if that had been me on the bed without family or a loved one, and a nurse started singing to me, that Oh, you sang her home, and that is, I'm sure, an honored position for you, but for her as well. And so, anyways, I just want to thank you on that. On that note, of my tears in my eyes, because that is, I can't believe I didn't ask you that when we talked about when you made that comment earlier. But thank you for sharing that. Um, Now, on the flip side of these gentle, thankful tears that I have in my eyes, let's talk briefly about dark humor and how that plays a role in your life. Or does it? I don't know. You tell me.
Oh, yeah. Well, dark humor in the emergency department tend to be synonymous. And I think, somebody made a comment last week about nurses, but emergency nurses in particular, like being the masters of compartmentalizing, um, because you have to move from one thing to the next without allowing yourself to stay in that moment. Otherwise, you wouldn't be able to treat the next person. Difficult situations to see and be involved in. And I really think that the dark humor that gets put out is a way to take that situation and put it in a box, where you can't get emotionally involved in every scenario, or you could never do the job. And I think it keeps people going, and it's a commodity. Can you say that?
Camaraderie.
Emergency. Yeah. Well, we're very much a family, right? And you know that you can let some of your humor out with some of your family better than in other situations. And I think that that's just kind of part of it. It carries you through
I
situations that others drown in.
I would say that you have exactly described what dark humor also does for the patient, because let me tell you, it gets me through. It helps me compartmentalize. It just helps me move on to the next thing that needs doing. Do you remember, Barb, the ER nurse, cousin friend of mine, that time when I had a fake heart attack? I ended up during the pandemic over here in England in the ER presenting with heart attack symptoms. Turned out it was my ME, myalgic encephalomyelitis. I can't say it again.
Encephalomyelopathy.
Yeah, yes, exactly. That thing. Anyhow, but while I was sitting there thinking that I was possibly having a cardiac event, in the middle of the night, the hospital playlist came on, and the first song, well, oh, what is, I can't remember the first song that came on, but it grabbed my attention, because then they started playing songs like, I'm not even kidding, Heart Attack by Demi Lovato, Bad Medicine by Bon Jovi, Stairway to Heaven. It was ridiculous. And thankfully, I had you and my sister in a group thread on my phone as I sat in this waiting room in like absolute, I mean, I was barely sitting because I could hardly hold myself up. But we had a bit of back and forth, let's just say, about what songs could be added to that hospital playlist, and had some questions about who might have created it. Like, so I've actually created a Spotify playlist called Fake Heart Attack now, if any of you are interested, featuring the songs that were playing during that time. But the back and forth honestly got me through that night. You too were on the phone with me via Messenger for hours, and I mean, cry laughing. I I don't know. It would have been the longest. Well, I suppose I've had some other circumstances. It might have been the longest night of my life in recent years, had I not had the two of you bantering back and forth. I mean, it was so ridiculous, because I think that some people would have perhaps sorry, some people would have perhaps taken offense to that, or like got mad at the hospital for playing such such silly music for a time such as that. Oh, If the World Was Ending was also playing, and it was in the pandemic. Like, it was just a ridiculous gong show. But for me, it was absolutely perfect. And so I I mean, you pulled out some zingers. Do you remember any of the songs that you thought of that could be added? It was a
I
while
don't
ago.
head, but yeah, that was, yeah, I enjoyed that conversation.
I mean, I don't know
I
if
said
you
I
guys
want
enjoyed it, but it sure I
100%. I've thought for so long that I would love, we're not allowed to play music in our department, but to have a playlist for our waiting room, I have a long list of songs that I would love to have included in that.
oh, I need to get my hands on that playlist. And I will say this. So my sister is not uh chronically ill. She's quite healthy and has a different sense of humor as I do, and she definitely rolled with it. But I feel like because of your experience in the ER and my experience in the ER, that we really were comfortable with that. I mean, it took some dark turns during that conversation, let me tell you. But honestly, anyways, thank you for that. We'll move on from the fake heart attack playlist. Um,
Example that it's a light dark humor, but when we teach CPR, the beat of it is staying alive, right?
ah,
So very fitting for what you're doing.
yes.
I really think that's appropriate, but the beat of it is the rate that you should be doing your compressions. So it's something that's easy to remember.
And I do remember now that you say that you added it to my playlist, my fake heart attack playlist. So yes, thank you for that. So just briefly, what are some misconceptions you think people have about the ER that you would like clearing up?
One of the most common things that we hear people, I shouldn't even say hear, if you read threads on anything, we always tell our coworkers, don't read the comments when something comes out in the media or something. Well, if the nurses weren't just standing around the desk, gabbing away, uh, standing around the desk is where we do all of our documentation, and documentation is huge. Absolutely everything you do, half the time the conversation that you've had with a medical professional has to be documented. So there's a tremendous amount of time that's spent at the computers documenting. That's also, people are passing you. I don't understand the disconnect between you are in your workplace and it's okay to stop what you're doing and say, hey, how are you doing? But from a nursing perspective, somehow that's not allowed, right? We're human. It's our workplace. We spend sometimes more time there than we do with our families. So you're certainly going to have those moments where I'm allowed to say, hey, how are you? It doesn't mean that I'm not providing care for you. It doesn't mean that we're doing nothing, right? I think that that's a tough one for a lot of people, is that, I've had where somebody, if you laugh, they're laughing at me. Well, no, not everything's about
Mm.
you. Um, if you don't smile, then that person is a, don't know whether I'm supposed to,
Say what you
but
need to say.
so it's very difficult because you can't please everybody, right? No matter what you're doing. And to have the understanding that we're all human, we need to be able to laugh in our workplace because that's what enables us to do our job. Is it always appropriate? No. There's certainly situations where I've had to go to staff members, hey guys, tone it down, right? Because we're so used to being in an environment where there's always critical stuff going on. There's always, horrible situations and people in crisis. So it can become easy to forget that for the people who are sitting in those beds, that's not normal for them, right? So for them, it's so inappropriate to behave that way. But this is day in and day out. This is where we live, right? We're currently with our extended family, right? So I think just remembering that the staff are human and this is their normal workplace, and it doesn't mean that they're not working, because anything about an emergency nurse is they tend to be very good at multitasking. You
Well,
have to be
and
juggling.
I would just say that thank God you guys get those moments of a bit of banter or um like if you weren't human, we as patients would be, I mean, I don't want a robot treating me. I want someone who can empathize and actually understand what I'm going through. And so you're feeling everything in your workplace, just like we're all feeling everything. And it you I mean, you guys have so much going on in your whole lives. Of course, you're going to share bits and pieces of that with, like you said, your extended family. I'll just throw out there now too that I know you once said to me that don't you often don't drink water on your shifts because you know you won't get a chance to use the washroom uh while you're at work. And I mean that just that says a lot, I would say, as far as like you said. I think the perception might be that you're just standing there, but actually you might be thinking about that conversation that you've now got to document or whatever it might be. So yeah, I would just say thank you.
There's lots of times when that little conversation that I took with somebody, I count that as my break, right?
Yes,
So,
of course. Yeah.
uh,
Well, thank you for that, because you deserve to be able to sit down, put your feet up. But uh
and then
yeah,
often I have a moment on the floor when I'm able to connect with a coworker, then you take it where you can, because there's often times where we're not getting away for a water break or a bathroom break or a meal break or just the 5 minutes to check out for a minute.
yeah. Well, I just want to say thank you, Barb, for being here today and answering some questions that I had about this whole world of yours. Thank you for singing to your patients and caring so well. And I don't even want to thank you for not taking a pee break, because that's ridiculous. You should be able to take that break. But also I want to thank you, as in the nurses and doctors out there who are doing such an excellent job. And I'll just throw out there that if any of you want to find me, you can find me on Instagram at medicalmiss_stress. And I have my website, lesshealthstress.com. You can find me there. And if you're interested in getting a weekly support letter to your inbox, you can, it's on my link tree and all my socials, or my website, but look for Convos with Carlos. That's my cute little white haired chihuahua, because he hears everything. It's Convos with Carlos, one care, one quote, and one question. It's just a short email, but I think you might enjoy it. So again, thanks so much, Barb, for all that you do and for being here with us today. You rock. And thanks also for all those late night messages you answer from me not sure whether I should go into the ER or not. And you're my first line off duty support of like, what do I do? Do I need to go in or not? Because I don't present typically. And so thank you for that as well.
Anytime.
All right. Well, we'll talk to you soon, friend and cousin and nurse extraordinaire. Thanks so much.
Thanks, Suze.
Okay.